The Wuhan coronavirus has shut down countries, snapped supply chains, and dealt a huge blow to the world economy. We've been focusing on accountability, on China, on how this could have been prevented. Starting tonight, we'll also look more closely at the second aspect of this crisis. Who stands to gain? Which countries, which individuals, and which companies stand to benefit from this crisis? We've put in weeks of research, we've spoken to experts, and now we are ready to roll. What is the one thing that the world needs right now? What is the one thing that the whole world is ready to pay for right now? A coronavirus cure, a medicine, a vaccine, anything that fights this virus. Whoever makes it first will be sitting on a pile of wealth. A global race is now on. Companies being backed by governments, researchers and big pharma, everyone worth their salt are in this race. But the thing with vaccines is this: they take time. You cannot rush it. There is a procedure, a set period for trials, a set procedure for human trials, peer reviews, and then certification. Development, approval, and production of a vaccine typically takes 6 to 10 years. Even if you fast-track everything, even if you put all your energies and money into it, a vaccine could still be at least a year away. But that's not stopping countries from making big claims. Proclamations of a cure. Heads of state are joining the chorus, claiming a magic cure, talking of miracle drugs. Donald Trump, he first touted hydroxychloroquine. Now America is trying another drug, remdesivir. Japan is pushing for something called Avigan. Italy says it has made a vaccine that works. Who should we believe? Do these cures work, or is this just hype? Tonight on Gravitas, we will take stock of the race for a cure. On this show, we like to call a spade, so let me say it at the very beginning. There is no cure. There is no magic bullet for the Wuhan virus. There is no drug to treat it yet. There is no vaccine. But almost every day now, we have a new headline, a new injection, a new pill that claims it works. Breakthroughs, I have to say, are becoming as banal as breaking news. There's little substance in the claims. Italy has become the latest country to join the global race for a vaccine. An Italian firm called Takis says it has developed a coronavirus vaccine. The company says their vaccine neutralizes, that's the word they use, neutralizes the coronavirus in human cells. With a claim like this, you would be forgiven for assuming that they've already tried this vaccine on humans. I'm afraid that's not the case. This vaccine has been tested on mice. There are some claims of a clinical trial, but no detailed paper on the findings. Let's just say this is work in progress. Then we have Israel claiming a significant breakthrough, quote unquote. The government is saying it. This breakthrough was achieved at the state-run Israel Institute of Biological Research. They have developed an antibody. It's not a vaccine or a pill. What is an antibody? These are proteins. Antibodies are naturally released by our immune system to fight a virus. Every germ, every infection has a corresponding antibody, like a key that fits a lock. The Israelis claim that they have found the antibody for the Wuhan virus, the key to this lock. Now, these experts say that if these antibodies are introduced into the human system, they should be able to fight the virus. It's a big if. There are no guarantees yet. It may or may not work. We hope it does, but there are no guarantees. Not to be left behind, Japan has thrown its hat in the ring. A new cure, it says. Japan is selling its own silver bullet. It's called Avigan, an antiviral medicine. It is administered through a pill. Japan's Prime Minister Shinzo Abe has given his endorsement to this drug.
我が国で開発されたアビガンについてもすでに
With regards to Avigan, which was developed in our country, it has already been administered to about 3,000 cases and the clinical trial is proceeding smoothly. With this data, if the efficacy is confirmed, then we would like to give medical approval so that it can be prescribed by doctors. We aim to get this approval within this month.
薬事承認をしていきたい。
Shinzo Abe believes in Avigan. He has pushed this homemade drug in news conferences and to world leaders. The Japanese Prime Minister made a mention of this drug during his interactions with G7 leaders. Japan has allocated $130 million to triple its stockpile of Avigan. He really does believe it. But prime ministers are not doctors, at least not most of them, they aren't. And there is no evidence that this drug works. The research is limited, trials are still underway. Avigan has had a peculiar regulatory history. It also has one dangerous potential side effect: birth defects. Despite the concerns, Japan is rooting for this drug. And I've cited just 3 cases. Such claims are being made everywhere. Madagascar, for instance. Madagascar has launched a herbal remedy to cure the coronavirus. The president has endorsed it. Needless to say, it doesn't work, but it's selling. Countries are in a mad rush to find the ultimate cure, you see. They're desperate. And who wouldn't like the big money that a cure promises? But this cannot be an excuse to make inflated claims. It's a matter of life and death. So for all of these leaders, here are the criteria that any drug needs to meet before everyone can start using it. We've spoken to experts again, and we have a checklist. Number 1, the drug must show that people are recovering. Not just a handful of patients, you need a reasonably large sample size. Number 2, they must go through 2 separate randomized tests. And in these tests, people participating in the study are divided into 2 groups. One group is given the drug, the second group is given a placebo. The drug needs to be tested in at least 2 studies before mass adoption. Number 3, these studies must have a safety database for sample size of 500. That's the recommendation of the US Food and Drug Administration. Criteria number 4, the drug must have a good safety profile. It should not have any rare or dangerous side effects. Number 5, more of an alternative option to test a drug. If a potential cure prevents an infection, it can be considered for approval too. Only after a drug has crossed all of this can it be recommended. Now, there are more than 1,200 studies underway to find a treatment that works or a vaccine, which is good, but false claims are not good. Before countries start making big claims, they should follow SOPs, standard operating procedure. Otherwise, these claims, I have to say, are no better than those of a leader who recommended drinking disinfectant to kill the virus.